Again, I want to thank Dr. Mark Kerouac of Bay State Health Systems, President and CEO, and Dr. Robert Bruce, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, for being here. After my update, they will come up and give their updates, and at that time, the press will be able to avail themselves to ask questions or comments of Dr. Kerouac and Dr. Roos, so they can get back to their respective medical institutions. And I appreciate everything they continue to do as we continue to collaborate and coordinate with our hospital systems when and if a spike does or will occur. We're in a very dangerous time right now, period in time, with this COVID-19. And I'm not going to mince any words today. It is getting very disheartening to see many of our young people, when I mean kids and young adults, who are not wearing masks whatsoever. Now, Dr. Kerouac, Dr. Roos, Commissioner Helen Carlton-Harris has indicated to you that the uptick in the COVID-19 cases has shifted the demographics dramatically. 76% are under 50 years old, 39% are under 30 years old. You kids and young people are not invincible, and it is showing now with our testing rate that's hovering near 10%. 10%. We had a very difficult weekend. We haven't seen these types of numbers since, I think Commissioner Helen Carlton will go into May. Friday we had 51 confirmed positive cases. There was weekends when I didn't even have a total of 51. 33 Saturday, 31 Sunday, for a grand total of confirmed cases of 3,865, 3,865 cases. We had 115 just over the weekend, and Helen will go over the weekly numbers, 115 cases just over this weekend. So when I say we're entering a dangerous period right now, we're going to check the stockpiles that we have here in our city reserves when it comes to PPEs on surgical masks and just masking, because I have to make sure our frontline providers have the proper PPEs. But in turn, I'm going to see if we can get some more orders in to start handing out masks at our school food sites as soon as possible. And Commissioner Clapprood and the police department will go back to, we want to make sure we have proper supplies, handing out masks too. It is just completely irresponsible what is occurring now, of that masks not being worn for our kids and our young adults. So stay tuned on that. We had, unfortunately, one more death that occurred, and again, our thoughts and prayers and sympathies and encouragement go out to all the affected families. That brings our tally up to 133. 57 of those are white, 31 are black, 43 Hispanic, and 2 Asian. The percentage breakdown for white is 42.8%, black is 23.3%, Hispanic is 32.3%, and Asian is 1.5%. The death occurred, I believe, was residential, so long-term care facilities, 57 have passed away, 76 in residential. We continue to deliver to our senior populations that are in need. The food deliveries continue. Helen and I, as do the medical professionals, Dr. Kerouac and Dr. Roos, urge you, please, 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 get your flu shots. Again, I'm very grateful to Governor Baker. He is extending Stop the Spread for testing. AMR, Pat Leonardo is here, and we appreciate the partnership. That's going to continue to at least January 15, 2021. We had some good things that happened during the week. City Hall, this past Thursday, we had our annual Rays of Hope, Pink and Denim Day. Al and Jackie Rodriguez. Al, who does a great job heading maintenance here at City Hall, and they're co-chairs. First Latino-Latina and married couple. Prior year was my old chief of staff, Denise Jordan, who was the chair, so we raised a good amount of money for the Rays of Hope. This Thursday will mark the 9th anniversary of the October 29th, 2011 freak nor'easter pre-Halloween snowstorm that knocked out power to tens of thousands of us across the area and across Springfield. And I say that because that was the same year we also got hit with the devastating EF3 tornado on June 1st, 2011. And the reason why I bring it up is that the resiliency of our residents and business community kept myself and cabinet heads and rank and file going night and day to make sure that we not only were able to persevere, but to rebuild and build on promise. And I say that now because we are doing it again with this COVID-19, and I want to thank everyone. So think back to those two situations, which we did get back on our feet, and we will get back on our feet with this COVID-19. The iconic and beloved Red Rose Pizzeria we are working with Helen Carlton Harris, and I have spoken with Tony and Rita and Carmela, and they're very appreciative of that. They've always run a first-class establishment, and they look forward to getting back open. And they want to be abundantly, overly cautious in all their deep cleaning and cleansing going on, but they will get back open, and we'll work very closely with them. They've always run an immaculate place. I want to thank the Springfield Rotary Club. They donated 10,000 surgical masks to our police department, Commissioner Clapprood, and fire department, Commissioner Calvi, and also another 1,000, I believe, were donated to our Springfield library system. We appreciate that immensely. Early voting, and a big shout out goes out to my election commissioner, Gladys Iola, and team is going very, very well, very, very steady. No issues whatsoever, so thank you, Gladys, on that. On the police front, Commissioner Clapper will go more into it. COVID-19, they're down 3. We did that special detail on the most annoying and disrespectful noise of these motorcycles, or mainly motorcycles, who have the illegal hookups of exhaust and muffler systems, and a detail issued 11 citations and 2 criminal complaints. And we're going to continue to crack down on that. It's just absolutely disrespectful, not only in our downtown area, but in our neighborhood areas. How these souped up motorcycles or dirt bikes continue to think they could do whatever the hell they want to do. Well, we're going to continue to track you down and make an example of you too. And if we have to arrest and confiscate, we will. And we're actually doing it for your own good, so you don't get hurt or you don't hurt any innocent bystanders or vehicular traffic. With that, she'll come into some big narcotics arrests that were made, some big gun arrests that were made. I was proud Commissioner Clapper was invited by U.S. Attorney Andrew Lelling to go to Boston, the big city chiefs, and speak about gun violence and what we are doing. She will elaborate on that. And I think both Commissioner Clapper and Commissioner Calvi will talk about a horrific incident that happened in a drag racing situation on Upper Plumtree Road, and put it out as far as and God rest their souls, an educational thing about how you put your lives in jeopardy. And they will speak of that horrific incident that occurred. Commissioner Calvi indicates to me from fire, 2 are down on COVID, and again, they'll speak to you on the drag racing incident. Superintendent Dan Warwick indicates to me that meals, nearly 3.8 million meals have been served, over 101,000 just this weekend. That's breakfast, lunch, dinner, and snacks. We continue to feed our school population and their families. The school building reviews, physical plant continue. Industrial hygienist Bob Kirshner will be meeting up sometime today, and I believe we're going to be briefing the school committee at Thursday's school committee meeting. Attendance rate, the superintendent will get into, is well over 90%, I think 92%. The flu shots have continued. An update will be given on our sports programs. iPads continue to go out to our pre-K, and they're still in the recovery process on the ransomware attack. Director Chris Signoli indicates to me that nobody is down with COVID, which is good. Yard waste is on time, which is very good. The Covanta meeting we had, and again, I didn't mince any words, and it was a good meeting, and there's actions that are going to be taken on the Covanta side, and to see why it occurred, what happened, what to do so it doesn't occur again, and then go over all their movement of the piles, temperature taking of the piles, etc. And also they're going to be putting in a water line on their own there. So that occurred last week. And we also have that 3 shifts. Our winter shifts are going to be starting November 30th with DPW. Central and Hancock Street, and thank you for your patience. It's in that area. Paving is starting to occur there. It's going to be tremendous traffic reconfiguration occurring there. In the parks and facilities, Director Pat Sullivan will comment on the Share Arena. Again, we were ahead of the curve on the state and doing what we're doing. We're hopeful that it can possibly be open November 7th, but we'll see, pending the state. Pat continues to do yeoman work with all our school and public buildings as far as physical plant, industrial hygienists. He'll have updates on that. Pat has now been affected with the Parks Department. He has 3 out with COVID right now. TJ Plant, my CFO and finances, and as I said before about MGM, that I expect them to live up to their obligations, and they are. We expect that $2.3 million to be paid November 1st. Deficit, again, since it started, we're down $5.8 million. We're down about $957,000 for FY21. Overall, 9.5 deficit in grants. Pawned off about 5. We're going to spend another $2 million pertaining to help Director Sullivan out on retrofitting our buildings and our schools to tackle this COVID-19. Chief Development Officer Tim Sheen will speak to you and echo Dev. I'm very appreciative of Governor Baker as we hopefully await something happening on the federal level. I spoke with Congressman Neal, Chairman Neal Ritchie last week, and I understand they're getting close on the stimulus package. But meanwhile, Governor Baker has put out millions of dollars, and there's a deadline by, I think, November 12th. So to our small businesses, I just sent a letter out Friday evening to our businesses, and these are grants. So businesses as small as 5 and under can pick up $25,000, but you need to apply right away on that. That's extremely important. Director Sheehan will speak of technical assistance will be available to those businesses that have difficulty doing that. And again, this will be targeted because of disparities in minority and women-owned businesses. On the law, HR, and labor front, Attorney Bill Mahoney indicates to me the unemployment rate has gone down. Springfield 16.2. It was 18.8 in August, and we had a high as high as 23.2. So going in the right direction. We'd like to have it go quicker. Food bank, Oasis Food Bank at Central High School. Again, with John Foley, we continue to serve about 3,500 families on Fridays with vegetables and meats and milk and fruits and vegetables. And I want to thank Commissioner Clapwood the week before. Commissioner Calvi had his troops up there helping out, and we had police men and women up there Friday, and it was very, very helpful giving out the food and connecting with our community. We appreciate that immensely. So with that, I will turn it over to Dr. Kerouac, the President and CEO of Bay State Health Systems, and then we'll go into Dr. Roos for their updates, and then the press and the media can ask questions at those point in times before I bring up my cabinet heads. And thank you again to the lovely sign language young ladies for being here for us. Dr. Mark Kerouac.
Well, good morning, everybody. Thank you, Mr. Mayor, for this opportunity. Thank you, as always, for your support of Rays of Hope. You've been solid year after year as far as that goes. And I appreciate your strong leadership through this crisis and the strong words you just shared. I share your concerns that we're entering a perilous time. COVID-19 cases continue to increase across the world, across the United States, and across Massachusetts. We're at 43 million cases worldwide, 8.6 million in the United States. New cases in the U.S. reached a new high over the weekend, over 80,000, with a 7-day average of 68,000. Deaths are still at 750 a day. Hospitalizations are up from about 28,000 a month or two ago to over 41,000 people in hospital today with the disease. Over a dozen states are setting new records for hospitalizations, and two-thirds of states, excuse me, are seeing increase in case numbers. We are clearly heading in the wrong direction. We are not turning a corner, and I'm sad to say that it will most likely get worse before it gets better. In Massachusetts, currently, we've had 147,000 cases. The last Thursday's report by town and city, 130 towns and cities got worse in terms of case levels. 77 ended up in the red zone, which was up from only 17 in early September. Over the weekend, new cases went to more than 1,000 a day for the first time since May. The towns in the red now include Springfield, Holyoke, Chicopee, East Longmeadow, Westfield, and Munson. And there are another 11 in our immediate area that are in the yellow area. Individual test positivity rates, and these are test positivity rates where we factor out those individuals who are repeatedly tested as part of screening, say students, etc. Individual test positivity rates have gone from 2 to 3% about a month ago to 5 to 6% today. So the increase in cases is not due to increase in testing. If we basically had the disease in a steady state and doubled the number of people tested, we might see double the number of cases, but the percentage rate would stay the same. Because the percentage rate is going up, we know that there is more of a disease burden in the community. At Bay State Health, we saw a low of 9 cases in early September. We went up in my last report to you to more than 20, and now we are over 30. Today we're at 35 patients, 28 at Bay State Medical Center, 7 in our community hospitals. None are in the intensive care unit, which is a good thing. This is partly due to the fact that we're dealing with a younger group of patients, but also partly because we have better treatments and can keep people off of ventilators and out of the ICU. I have nothing new to report regarding testing, personal protective equipment, or treatments. As far as surge capacity goes, all of Western Mass, we're using 25% of our available ICU beds and 55% of our routine beds that have been earmarked for COVID. At Bay State Health, we know we could surge to 100 by just rearranging where patients are and cohorting. We could add 300 more beds if we shut down elective procedures as we did back in March. The only other thing I'd share locally, the state has announced its vaccine distribution plan. It is a phased approach. In the phase 1A, it would be healthcare workers and people with high-risk conditions. Phase 1B would be essential workers. Phase 2, when there's a bit more vaccine to distribute, it would be people in some way connected with the healthcare system, patients at our hospitals, our clinics, our health centers, federally qualified health centers, and health centers of the sort that Bay State runs. And then when vaccine is abundant, there would be multiple distribution sites. That would be phase 3, such as pharmacies at other retail outlets. It is still many months away. I suspect that we'll probably have a vaccine approved early in 2021. But in terms of when will it be, when enough people are vaccinated and when case levels are so low that we are going to get rid of some of these burdensome guidelines, I'm guessing that's probably late spring, early summer. So it's going to take a while for us to get through this difficult time. We are continuing to learn more and more about the virus, and there were a couple of studies I wanted to share with you that touch on things we've talked about in previous sessions. One is the effectiveness and duration of immunity. There was a recent study just published from Mass General Hospital of 340 cases. A little over 90% of them had been in the hospital. The good news is 95% of the patients had effective antibody responses that went on for at least 90 days, probably longer. So a lot of the early worries that immunity was not going to be effective or of some duration, I think that's less likely as a result of this study. In the area of childcare, there was a large study of 57,000 providers. 427 of them were infected with COVID. There was no correlation between those infected and how much time and how intense their child care experience was. So it does appear, based on this study, that the approaches that have been used to limit the spread within child care facilities seem to be effective. And then finally, a gigantic study out of India where they looked at 85,000 cases and the contacts, 500,000 individuals who were potential contacts. They determined that attack rates depend a lot on the circumstances. There was one episode in which there was an 80% attack rate among folks riding in a bus with the windows closed and crowded situation for more than 6 hours. However, within a household in which there was a case, the spread was only 9%, and in general, about 2 to 3%. The interesting part of the study to me was that 8% of people caused 60% of the spread. 8% of cases caused 60% of the spread. And 70% of the cases seemed to cause no spread at all. There were no identified secondary contacts. Sort of the old 80-20 rule, the majority of the spread from a minority of the cases. This is consistent with what we're beginning to learn about when people are infectious with this virus. It turns out that a couple days before the onset of symptoms and a couple days after, people are shedding a lot of virus, most people. For people who remain asymptomatic, it's a couple of days before they're tested positive and a couple of days after. This means that everyone has the potential to be a super spreader even before they know it, but that the duration of infectivity is probably shorter than what we thought just a few weeks ago. Once cases become so numerous as they are today, it becomes harder for people like Commissioner Carlton-Harris and for us in the hospital to trace and determine where the clusters are occurring. If things are popping up everywhere, it fairly soon can overwhelm the people who were assigned to do contact tracing. That's when people start talking about more draconian measures like locking down. To me, I don't think we have to go down this road. We can keep opening up by following the guidelines. The great majority of restaurants and retail establishments have been able to manage to prevent spread by following the guidelines. And it's all about the same stuff we've been talking about: masking, social distancing, hand washing. I note that Dr. Redfield, the head of the CDC, just last week in front of Congress said that he thinks the mask he wears provides him more protection than the vaccine he'll get next year. Sadly, this has gotten into some political issues related to individual rights, but we all know that nobody has the right to harm somebody else. People who feel well can't be sure that they don't have the virus, and there have been multiple high-profile examples. I heard one line which I thought I'd share with you, and that is, "Your right to do what you want with your fist ends where my jaw begins." And so I think that Rights are not limitless. We also have responsibilities to each other and to our communities. I think that we should also get past the idea that this is a trivial disease. There have been a small number of scientists who've come out saying we ought to let the young people get infected and protect them from the older people. First of all, aside from the difficulties of separating the young and the old in our society, this is not just a matter of life and death. The so-called long haulers, people with symptoms that go on for months and months, having to do with breathing, energy levels, and memory. We don't know how common they are. I've seen some estimates that say that it's 10% of those infected, perhaps 25% of those admitted to hospital. Nobody would volunteer to get this disease simply to improve the herd immunity of the rest of the community. So there are no easy solutions now, unfortunately. And the challenge, the more I think of this, is much more than following simple rules about masking and hand washing. It's about whether or not we can discover a sense of commitment to community and each other, and I certainly hope we can. And of course, I have to end as I always do. There's simple things to protect yourselves: masking, social distancing, washing your hands, and getting a flu shot. So as always, Mr. Mayor, thanks for the opportunity, and I'm afraid I'll be seeing you next week too.
Thank you, Dr. Cheryl. Dr. Roos, we'll now have Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare.
Thank you, Mayor, and good morning, everyone. I want to thank you for your continued leadership with you and your cabinet here in the city of Springfield. I also want to thank the media for the continued attention and bringing fact-based information out to the entire community. And Mayor, the message you sent today was very clear and very accurate, and I could not agree more, also with the words of Dr. Kerouac. We are at a critical crossroads here in our community and across our country. We do not have a vaccine that's ready for deployment. We do not have a cure of the coronavirus. All of the data is pointing in the wrong direction. There are vulnerable members of our community that remain at risk and are dying from this disease, and there are countless others who are at risk, whether they recognize it or not. Yet, we all hold the power, each of us, to be able to reverse the trajectory of the past several weeks, to reduce the number of new infections, and to save lives. We're dealing with a virus that is easily transmitted in the air. And with each new infection and more people with the virus, we know that the statistical risk of becoming infected and having even more infections continues to go up. It's that simple. And as you can see here, from the epidemiologic curve in the United States, we are now firmly in the third wave of rising infections across the country. Twice over the past week, we've set a record for the number of new infections in one day. As was mentioned, over 85,000. We are the only country in the world whose epidemiologic curve looks like this, where we've had 3 waves, where each wave has surpassed the wave prior to it. There are dozens of states who are setting new records for daily infections. There are several states, including Utah, who are thinking about how they can implement rationing of care because intensive care units are becoming full. There are states like Wisconsin who have opened up a field hospital to care for patients who are ill with the coronavirus, and others like Tennessee who are suspending elective procedures to make room in the facilities. Here in Massachusetts, despite what I would call a very consistent and coordinated public health response, and where we've largely done better than much of the rest of the country, we also continue to see the rising numbers of new infections, with over 1,000 new infections reported both days over the weekend. We're also seeing rising numbers of hospitalized patients, with the average number of patients in hospitals here in the Commonwealth at over 550 which is up more than 50% since Labor Day. And when we look at the test positivity rate, as was mentioned, amongst individuals, that curve continues to go sharply up and is now over 5%. At Mercy, our current numbers are fairly low. We have only 3 hospitalized patients with COVID, and 1 of whom is in the ICU. But we have seen increases in the numbers of admissions each week over the past 6 weeks, and we're seeing more positive tests now in 1 week than we have since the end of April. Our test positivity rate this past week has climbed now to over 3%. And so, as it stands, all the signs are pointing towards a second surge of patients needing care over the next few months. As the weather gets colder, more people will spend time indoors. And unless something significant changes with each of our behavior regarding the precautions that we know can reduce the level of transmission, it's inevitable and expected that more people will contract this disease. More will enter the hospitals needing treatment, and more will need follow-up. Unfortunately, this is tragic, and it would have been and could have been and should have been largely prevented. This now will be the case whether or not we have a vaccine candidate that's going to conclude their clinical trials over the next few weeks or months, or not. As you know, there are many vaccine companies that are currently engaged in phase 3 clinical trials, but it's unknown exactly when those trials will conclude and what the results will show. The Massachusetts Department of Public Health did release its draft vaccination plan, and it expects to receive the vaccine in a phased approach, with that first phase limited to healthcare workers who are at risk of acquiring the coronavirus. But it also states in there that it knows that any initial allocation of the vaccine will not be sufficient to immunize all the providers necessary in all of the facilities. And then it would be a broader distribution out to other hospitals, to pharmacies, and other vaccine providers. There are also many challenges with a potential vaccine, including storage at cold temperatures, including distribution, and in many cases, a second administration of a vaccine. All of which are challenges that I am confident that we will figure out and manage, but just not in time to reduce the risk of infections and hospitalizations over this winter. And so at Mercy and throughout Trinity Health in New England, we are bracing ourselves for a second surge of patients. I'm going to share with you today some of our guiding principles. And as a system, I believe that we are well prepared. We've incorporated many learnings over the past 10 months in response to what we've learned about the disease and its treatments. We are well informed about what works and what doesn't in terms of reducing the risk of transmission. We know how to better treat patients and have more therapeutic options to reduce the severity of disease. And we've expanded our ability to continue to provide care in new ways, even from home, with virtual care and telemedicine. We are prepared to be here for you, guided by the following principles. First, as we have all throughout, ensuring safe care for everyone. We will continue to cohort patients in areas for COVID and areas that are not for COVID. Right now, we have just 1 unit in operation for patients that are under investigation or with COVID or quarantined for other reasons. But we do have a surge plan that allows us to expand into other areas as indicated. We will maintain our policies and our procedures that have kept people safe and support masking and distancing and staying home when people are sick. We are expanding our testing options and our capacity for both SARS-CoV-2 and influenza. And we realize and we will continue to educate and target the vulnerable amongst our communities and those communities that are at highest risk of contracting and having complications of COVID. Secondly, our focus in this second surge is maintaining access to all types of care. We've also demonstrated as a health system that we are able to care for both COVID and non-COVID patients in parallel, safely and seamlessly. We've recognized, and there have been studies to show that delays in care, putting off preventive care, putting off chronic disease management, or not coming to emergency rooms can put a patient's conditions or their life at undue risk. And so we are prepared and working with hospitals throughout our region as part of a Massachusetts Hospital Association collaborative in concert with the Department of Public Health guidelines to ensure that even as infections and hospitalizations rise, we are able to continue to provide those essential services: preventive care, chronic disease management, elective surgeries and studies, in order to keep you safe and well. And third, our focus amidst a second surge is supporting all of our colleagues with being empathic, resilient, and staying safe. I spent last week talking about some of the ways in which we can all combat pandemic fatigue. We understand that caring for people amidst a year-long pandemic has been exhausting, mentally, physically, and spiritually. So we continue to focus efforts on workshops for our staff to build resiliency, to make connections to the people in their lives they know that could be at risk, and to stay safe. With these three guiding principles and safety as a core value, Mercy will continue to be here for you. I am heartened by the commitment that our colleagues at Mercy have shown all throughout this year. And I'm reassured by the ways that we continue to support public health and respond to the needs of our community. But I implore us all to get back to the basics, to keep it simple. If we can keep ourselves safe, if we can realize that this is about something bigger than each of us, then we can suppress the virus, that we can reduce the level of infections, and we can prevent unnecessary illness, loss, and economic damage. We do not need to lock down. We do need to follow precautions and think about each other. Each moment and each interaction matters. So please do follow the recommended precautions and mask when out in public, physical distance with those that are outside your bubble, stay home and quarantine if you're not feeling well, and consider getting tested. Let science be our collective guide. And this week, don't forget to vote. Your vote and your ballot is one way to exercise your voice. Thank you.
Thank you, Dr. Rose. Now have Dr. Cheryl after Dr. Rose up for any questions or comments from the media.
Doctors, I'm curious, you both talk about the rise in test rates and how the cases are moving in such a pace that it's not that we're not testing enough. But there is, of course, a testing component that's being able to identify whether it be a cluster or whether it becomes a cluster. Are we at a stage now where basically anybody can get a test if they want to? Because it does seem to me, when I look at the data from the state, that we're not saying we may be testing more, we're still not testing as much as we might need to. And is that a problem with capacity, or is that a problem with people just kind of forgetting that that's even an issue to consider?
Well, I think you've gotten it exactly right. We're testing a lot more than we used to, but not at an ideal level. I think an ideal level would be walk-up testing or drive-up testing without provider's order in multiple locations that are convenient for people. And while we've gotten close to that in some areas with the Governor's Stop the Spread campaign, we're still a ways from where it ought to be. It's still a ways from where it is in many other countries. We've come a long ways with testing, and the major rate limiting step for us is the availability of reagents, the chemicals that you need to do these tests. And we are routinely haranguing our suppliers. But because we're competing with a surge going on in the rest of the country, it's a supply-demand issue. And so there's more demand for testing across the country, and oftentimes our orders are delayed or only partial when they finally come in. We would like to test more.
I would just echo the same. Nothing else. Yeah.
And I'm also curious, if I would open this evening, but I know that our doctor specializes in more substance abuse, mental health issues as well. Not as an argument against reopening, but as an argument against allowing us to be in a position where we might have to roll back. Can you discuss some of the mental health concerns that come from a closure that could be avoided? I don't want to talk about it as like, well, it's either, COVID deaths or mental health, but then, we can avoid that if we, that's the risk if we don't do that.
Sure. So I think you're appropriately bringing up what's a very complex dynamic here. And it is not, I think, in any of our interests, and certainly not the way that Dr. Kerouac and I have talked about this morning. We are not in support of a lockdown currently. With the way that we've managed this pandemic overall, I really think there was a missed opportunity earlier in the pandemic when the rates of infection were much lower. And when the rates of infection are lower, you can then employ actions that could suppress those rates even further and nearly eliminate or seek to try to eradicate the transmission. The greater the number of infections and the greater number of people in a community that have it, the more challenging it is to then reverse that course because it's already out and people are in contact with other people more readily. And so the opportunity for, amidst a pandemic like this, the opportunity was earlier on to try to exert actions significantly enough to the extent that we've talked about, the masking, the distancing, the behaviors that can reduce infection, to have us in a different place than we are now. What we've seen, because largely this disease has isolated people, both partly because of recommendations, and partly because this is what people have done to keep themselves safe, is that there has been an increase in many behavioral health related symptomatology or conditions. There have been studies that have shown the significant increase in the rates of alcohol use. There are communities that have seen increases in opioid overdoses and overdose fatalities. And there's emerging reports that people are experiencing higher levels of depression, anxiety, or other stress-related symptoms that can pertain to their mental health. Those can all be combated, I think, at the same time in parallel while we reinforce what we need to do to stay safe as a community. They're not mutually exclusive, and they aren't directly related. We can create physical distance without losing our ability to connect to people by using technology, by engaging in different ways. We can support people with healthier behaviors and we've created new mechanisms to be able to deliver treatment and support people amidst the pandemic in sort of managing depression and anxiety. And we can continue to open up and engage in activities like school and other types of recreational activities as long as we take the precautions that are necessary to reduce the spread of COVID. So this is a complex issue where there's multiple factors. They are not exclusive of each other, but I think we need to be supportive of how we best stay safe that encompasses the entire comprehensive nature, holistic nature of a person.
Mr. Master.
Okay, this is the 30-second version of a 47-page document, but it's three phases: 1A, 1B, 2, and 3. 1A and B happen when vaccine supplies are limited, and then you would be restricting it to healthcare workers who directly care for COVID patients, patients with those high-risk conditions that make a COVID infection more likely to result in serious illness or death. And the third category, 1B, is for essential employees, and I honestly don't remember the precise definition, but it would be a slightly wider ring. In number 2 would be people who are in some way connected to a healthcare provider. Either they're a patient in a doctor's office or a health center or a hospital, meaning that they would be more likely to have some kind of a chronic condition under a doctor's care. That would be step 2 when you have more vaccine. And then when you have it widespread, otherwise healthy people, you're trying to get the entire population vaccinated, then you would administer it. In addition to those hospital or doctor's office settings, you would administer it broadly in retail stores, pharmacies, et cetera.
Thinking about that, with respect to those who are elderly and long-term care facilities, like shelters, is age considered high risk?
Yes. Age over 65 is considered high risk, and it's even higher if you're in a congregate living situation. So those would be the 1A, in the 1A group.
Okay, and when it comes to the distribution, did I hear you mention the committee happening anytime before spring of 2021?
I think that we're not exactly sure. The FDA would have to authorize it as safe and effective. For the leading 3 contenders, the United States has pre-purchased tens of millions of doses, which would then be allocated or distributed. There have been a couple of federal allocation schemes that have been suggested. One, which is the typical one through the CDC, there is something called the Advisory Council on Immunization Practices, ACIP, out of the CDC that distributes vaccines. That would be the conventional way. People have also possibly talked about the Defense Department and the military getting involved. But in any event, the state would receive an allocation. And what was published over the weekend was the state's plan, once it got its allocation, to then distribute it to the population.
And I guess my final follow-up question on this topic for both of you guys, given that healthcare workers are in that very first category, have either of you guys, either of your institutions, received any sort of pushback or concern from the healthcare employees about actually receiving the vaccine themselves?
No, I have seen comments in the general public about people not trusting a vaccine that's been produced so rapidly. I've been heartened to see that the FDA safety panel has really drawn a line in the sand to say that they'd be guided by science, not politics, in their decision to release. I've not heard anything among our employees saying, hell no, I won't take that shot. I suspect that there are likely some people who will not be anxious to be the first ones to step up, but I do believe that once a number of people do step up, and once particularly the scientific community endorses it, there will be widespread uptake.
I think what Dr. Karabach is mentioning is key. Once the scientific community has sort of weighed in on the evaluation of the safety and efficacy, classically, healthcare workers have some of the highest rates of vaccination amongst any groups, and we expect that our providers are going to be, by and large, all vaccinated for influenza, with rare exception. And when we get to the point of the coronavirus vaccine, we will evaluate that and look to work with our colleagues in the same fashion.
Dr. Molina from 22 News.
Now, I know you guys both mentioned that there's no need to lock down the businesses and still keep reopening, even though we are expected to. You both did say that things can get worse before they get better. Will there be a point where businesses should start to think about that?
I don't think yet. There was an interesting press conference, and I'm sure the mayor was aware of this one, in which 3 or 4 of the towns that are seeing a very heavy burden of infection and had gotten their arms around it, stepped up to say what they had done. The mayor of Revere was quoted, I think in the Boston Herald or Commonwealth magazine, one of them, that essentially you need to sort of go where the action is. And the action is now in private gatherings. And so the mayor of Revere has asked the police to crack down on private gatherings, and which is a big step, because obviously the police have got plenty of other things to do, as we just heard. But to actually close down restaurants or retail establishments where the infection is not spreading really won't have an effect on the places where the infection is spreading. We initially locked down in early March when we didn't know much about the mechanisms of spread and didn't have the infrastructure to tell you where the clusters were happening. Now we do, and we really need to focus our attention on where the spread is happening. Otherwise, it's not going to be effective. And it's going to be very difficult, I think, but there have been a few mayors in much more hard-hit towns than Springfield that have come down very hard on even private gatherings, which is, I understand it, a very big step.
You know, the defining feature of a effective public health response is to continue to follow the data and let the science guide us. And we both have education and training in public health, and I think we can continue to follow that guidance to bring us to the place where we need to get to.
So would you say that the infections are more so in private gatherings than in public places?
That is what has, you know, the efforts of contact tracing and testing are so important. And in conversations that we've had here over the last couple of weeks, it does appear that the large number of infections in areas where there's been clusters have been related to private gatherings, not related to institutions or establishments engaging in other
You're going to
activities.
see in Helen's,
Yeah.
Commissioner Helen Carlton Harris, in her update, she'll say the numbers, as Dr. Kerouac and Dr. Roos indicate, private gatherings, house gatherings, family gatherings. And we are, and I appreciate Dr. Kerouac, Dr. Roos saying, we're in a balancing act here. So we want to try to keep the economy going within reason and target those hotspot areas with mitigation on it. That's what the numbers seem to become. Helen, when she speaks, will elaborate on. She'll give you the zip codes again. That's where it seems to be coming.
I guess it's my last question.
No,
I know we're also in the flu season as well. Like, it's where we understand with that, people worry about some endemic that's, concerning some people.
Yeah, you know, we are concerned that a increase in flu cases coming at a time when there's an increase in COVID cases could create additional complexity and complications for the individual, but also for the community. I'm hopeful, although it's not for certain, that we will have a milder flu season because of many of the precautions that we're taking, including wearing masks and practicing hand hygiene and staying further distance away from people in certain settings. Those are the same elements that will help reduce the transmission of influenza, just as they do for the coronavirus. We've also taken some steps to implement a mandatory influenza vaccine policy in healthcare institutions like Mercy Medical Center, and there's been other actions that will help reduce the risk there. So at this point, we have not, at least at Mercy, been seeing an increase or of influenza cases, but we're certainly on the watch and we'll be tracking both.
Nothing to add to that.
She's great.
Cases go off, it's more difficult to contact tracing. The report this morning that the state is unable to identify what's happening. Why is contact tracing been so difficult?
Well, there are a lot of things that go into contact tracing. Typically, once you've made a diagnosis, if you need to do it promptly, then you would interview that person at length about all the places he or she may have been in the previous week or two. It then assumes, of course, that person is going to be forthcoming, is going to answer the phone calls, and then the people you try to call and contact will themselves answer the phone. So that's if everything is good. Once you start having cases pop up here and there, you can simply overwhelm the capacity of the contact tracers by sheer numbers. That's number one. And then secondly, the signals get complicated because a given case may have, or a given case may have been in multiple places where spread is occurring rather than a single place. So that narrowing it down to a single place means you really have to have a fairly low baseline to make it clear where that cluster is occurring. So it's a complicated business even when everything is straightforward. And now with the overall levels coming up, we've made it even more complicated.
Anything, I just had a quick question about Dr. Roos and Dr. Kerouac. The South Korean model, that has seemed to work pretty well. Could you comment on that? Now, again, different than here, but
Yeah, South
that
Korea
seems to be the top model that's worked.
There are a number of the Asian countries that have been held up as amazing models. South Korea and Taiwan in particular have had 1/100th the rate of new infections that we do. They have abundant testing of the sort that was referred to earlier. You can go up to walk-in booths on many street corners and be tested promptly. That's free. They also have dormitory or hotel-like situations where people get sick, where they're actually can recover separated from family and friends so that they don't spread things. And people are, as a group, more trusting of science. So when the president of South Korea said everybody wear a mask, 95% of people did, versus the rate in America, which is on average 50 to 60%, and we're maybe a little higher in Massachusetts, but not that much.
In South Korea, back to my question on contact tracing, in South Korea, use the phone apps as well as contact tracing?
The phone, yes, they did. It's not clear to me that they added much to their telephonic approaches, though. That's when you may receive a text on your phone that, you know, we have reason to believe that you've been in touch with somebody, you've been near somebody who had COVID because your phones were near each other. It's not clear to me how much effect that had over and above the regular contact tracing.
There's another study I remember hearing about in naval some of this about how white children are not as effective as their immune system is a little bit different. Are there ways that we can be able to see how immune systems are responding to something that might not show up in the antibody test? Or is it this kind of thing where some people are just not responding to react to virus and some people are?
Well, the issue with the kids under 10 is that they may not have enough receptors for the virus and they may not have as productive an infection. Whenever anyone encounters a virus, any old virus, there's kind of a generic response that gets put up. It involves things, chemicals like interferon and bradykinin that, you know, again, we're not going to get into an immunology seminar, but that's sort of the local defense against a generic virus that prevents the virus from growing. Within a week to 10 days, antibodies that are specific to that virus, which is really like the ultimate defense, begin to emerge because the immune systems had the time to process it and develop those antibodies. And that's really what ultimately kicks out the virus. It also can stir up an immune response, which is what the steroids are used for as well. But we know that most people will mount a generic immune response that will tamp down the virus to a certain extent, but not completely effectively until the cavalry arrives, 10 days to 14 days later, in the form of specific antibodies.
And you really started believing about how they say handling these patients that are not going in the ICU and they're cutting down dramatically their time in the hospital. Is this a trend that just hospitals generally across the country or even across Massachusetts? I mean, I've seen, Boston rates, stay much higher on a regular basis than ours out here. I mean, a lot better. Why isn't you guys? Is there some reason for that?
I think in general, our ability to treat the virus has improved, and it involves some reasonably, modestly effective treatments like remdesivir and immune plasma, some very effective treatments for severe cases like dexamethasone, and then some non-pharmacologic treatments like positioning and high-flow oxygen, which keep people off ventilators. Bay State was an early adopter of those, but the rest of the country is adopting them now as well. And so we're seeing much less of a, the death rate has been falling slightly from about 1,000 to 750 at the same time that the case rate has been rising from 40,000 to 80,000. So almost twice the number of cases, but a death rate going down because it's happening in younger people and we have good treatments.
Any questions or comments? I want to thank Dr. Cheryl and Dr. Lucen. Heed their advice. We have been, whether it's from Governor Baker on down to Dr. myself, Dr. Kerouac, Dr. Lucen, sending the same message. And I mentioned the South Korean model here, and you can't have a disjointed message coming out. from the federal level. And I think they shouldn't be playing politics with this. It should be public health. And, now we're trying to educate for the Commissioner Clapper, Commissioner Helen Carlton Harris, but it might get to the point in time that we're gonna have to enforce now. We're gonna have to enforce the masks or these parties going on, and you might not like that, but it can eventually save your life or a family member's life. So enough of this BS of my rights and this and that. Follow these procedures, because I thoroughly believe, and it's now backed up by Dr. Cheryl and Dr. Russo, and Specialist Helen Carlton Harris, we are entering a very pivotal and dangerous time with this COVID-19. And
You're right, it's a test of our ability to come together as a community.
it's got to be one succinct message. Is it that aggravating to put a mask on? And people just to say, I'm going to just, on principle. Difficult to say that on principle if you're in a hospital, God forbid you're on a ventilator. So, send them a message.
Thank you, Dr. Thank you.
Thanks, everyone.
Good save, good save. You made another save there. Way to go, Dr. Caraway. Thank you for your time. The Helen Carlton Harris, who I respectfully, affectionately call the elegant and eloquent one, but our own Dr. Anthony Fauci, will come give an update. Please heed her advice. We just were on Thursday night again with our neighborhood councils to use them as conduits to get the word out pertaining to this COVID-19. So without further ado, I will bring up Commissioner Helen Carlton Harris. Thank you. You want me to play Vanna White, Helen, or? Bill Baker's going to play Vanna White? Shark Turner. I'll buy a vowel.
Thank you, Mayor. Thank you for your support. Let me start with my thank yous. I want to thank Tim Sheehan. Tim rescued me today by bringing another stand with him. What economic development director that you know carries a stand in their car ready? Tim is always prepared. Thank you, Tim. Thank you to Jason Mann for his work, Axiom Blue for your work, Carisha Gonzalez for her work, and of course, the Department of Health and Human Services. As the mayor said, the city of Springfield has 3,865 positive cases since the beginning of this pandemic. Statewide cases are 147,120. The Commonwealth of Massachusetts had 968 cases on Friday, Saturday, 1,128, and on Sunday, 1,097. This is the first time since May that the Commonwealth has experienced 2 days of over 1,000 cases. Here in the city of Springfield, we had one of our highest days this week. Bill, could I ask you to start with this easel over here on this side and just turn it completely around, and we'll start with the first chart. And the first chart that you are looking at is really looking at the cases from last week and compared to the cases from this week. Last week, we had 107 cases in the city of Springfield. This week, we had 211 cases. That is an increase of 95 cases in this city, 1 week alone. Monday of last week, there were 18 cases. This week, 31. Tuesday of last week, 10 cases. Tuesday of this week, 25. Wednesday of last week, we had 24. Wednesday of last week, 20. Thursday of last week, 11. Thursday of this week, 20. And Friday of last week, 8 cases. This week, 51 cases. We have not had 51 cases in this city since May 9th, when we had 57 cases. And so our highest day was Friday. Saturday, there were 33 cases, the previous week 14, and then on Sunday of last week, 22 cases. This week, it was 31 cases. Let's look at the next slide, which is the confirmed cases by age. We'll take a look at the 0 to 10-year-olds. There were 28 cases. Bill, are you able to follow with that? Let me see. Should be this. Okay, thank you. The cases by age, 0 to 10, 28 cases, 11 to 20, 32 cases, 21 to 30, 33 cases, and then 31 to 40, we have 40 cases, and 41 to 50, 25, 51 to 60, 23, 61 to 70, 17, 71 to 89, 81 to 92, and 91 to 102. So the group that I am concerned about, obviously, is that group, while we're concerned about all ages, the 61 to 91 age group really is that age group that could potentially wind up in the hospital and could be at higher risk. So we want to make sure that we know that there are individuals in our older age group that are impacted. However, last week, when we look at the percentages by age, last week, the age group under the age of 30 was 39%. This week, it's 44%. Last week, the age group that was from 31 to 50 was 37%. This week, it's 31%. Last week, that last group, 51 and older, was 24%. This week, it's 25%. So it has maintained pretty consistent as far as the age group is concerned. But this week, there was 75% of the ages in the city of Springfield were under the age of 50. Last week, that number was 76%. And so we're staying pretty consistent that the age group in the city of Springfield, where we're seeing the predominant virus, is in the group that is under the age of 50. And that age group under the age of 30 has increased. Remember, last week it was 39%. This week it is 44%. I want to talk a little bit about the trends before I talk about the other areas that we are seeing some concern in. In the beginning, this pandemic was really a pandemic or a virus, COVID-19. We were talking to you predominantly about long-term care facilities and nursing homes. We have pretty much, I think, as a Commonwealth, as a nation, gotten that area of the pandemic under control. The new numbers are not coming from long-term care facilities. However, they are coming from our residents. Homeless or unsheltered individuals are not contributing to the numbers that we are showing you. There is an increase in areas as far as higher education is concerned, but it is not a significant cause of the increase of the cases. Household transmissions are the primary source of infection. Small and large gathering are the primary source of infection. We are seeing multi-generational households where we are spreading where infection is spreading. Ages of individuals who are infected continue to be the age group, as I said, under the age of 50. And so we know that in the city of Springfield over this last week, we've had a surge. We are technically in our second wave. I say that because the city of Springfield was green, and so we had got our infection down to a rate where we were comfortable and feeling as if we had some control. We understood there was still community spread, but the prevalence of the virus had gotten to the point that the city was in a good place. We are no longer there. So you might ask, what has the city done and what will the city do? The mayor and I have participated in 2 neighborhood council meetings to share data and to provide updates. We will continue to participate in the neighborhood council meetings and share the update and answer any questions that any neighborhood individual may have. We have convened the COVID-19 flu and cold weather task force. That task force is charged with asking questions about COVID-19, sharing best practices, and being able to advise each other on the steps that we are taking. We are doing that as far as flu is concerned and the cold weather. We have another meeting of that task force this Thursday. The mayor gave opening remarks at our task force meeting, and I expect that he will do the same this Thursday. That task force will continue to meet to advise the city and myself and help us get the information out in our neighborhoods. Businesses, including restaurants and streets in high prevalence zip codes, will be targeted for education and compliance purposes. We understand that the majority of the spread is not coming from our businesses. However, what we do know is our residents are in and out of businesses. We are asking our businesses to be vigilant, assure that face coverings are mandated when individuals walk in your businesses. Protect the residents, and please protect your staff. Your staff are frontline workers, and your staff are individuals who are coming in contact with the public too. Again, we will be out to those businesses to make sure that you are following the guidelines. Businesses in large box chain stores will be targeted as well. Many essential workers who work in these stores risk exposure and have no choice but to work to feed their families, such as individuals working in grocery stores, the Home Depots, the Lowe's, the Targets, the Walmarts, the big box stores. We will be in your stores assuring that you are following the mask mandate that the city of Springfield put out on May 9th. We will use our existing networks, libraries who are doing curbside pickup, the Raymond Jordan Senior Center lunch program, Springfield Public Schools, as the mayor said, lunch program, to put information in their bags when their meals are delivered. We will be working with civic associations and neighborhood councils as well. We are asking, if you are an elected official that represents the city at large or represent a ward, please be active in reaching out to your constituents. We need all hands on deck right now to put a dent in the mitigation to make sure we are doing the mitigation that we need in communities. Public transit will be targeted as well. We will be putting messages on buses, but we will be assuring that in buses, individuals are wearing their face coverings and that we can help individuals social distance to the degree that we can. What initiatives will the city collaborate with the Commonwealth of Massachusetts? Today at 5 o'clock, a phone call alert will go out to all city residents that will resemble an Amber Alert. You will get an alert on your phone today that will talk about the status of the city of Springfield and will tell you the steps that you must take. However, I know that you know these steps already, but that Amber Alert or that phone call, which will sound like an Amber Alert, will be going out today. At 5 o'clock. Materials are ready to be distributed. We will distribute those materials by the venues that I just named to you, the libraries, the senior centers, the lunch programs. Those materials have been personalized with the City of Springfield logo on them. We want to make sure that you know that it is your city, along with State DPH, that is asking you to do these things. The mayor and I will do another robocall shortly to all of our residents, once again advising our residents that what they need to do in order to stay safe. We have talked about the PSAs, but our PSAs will begin shortly, the public service announcements, and they will again ask you to do the things that can mitigate and prevent this virus. The City of Springfield will be active. We are not taking this virus laying down. We understand that we are in a time that all of us must pay attention. Stop the spread will continue. We had thought, as the mayor said, it was going to be January the 15th, but the actual end is projected to be December the 31st. That information just came to us, so we can adjust that to be able to understand that you can get tested. And I want to commend AMR. They have done 24,709 tests since they have started participating in Stop the Spread. Springfield residents have been 10,142 of that number, and the positivity out of that 10,000 has been around 1,000 individuals or so. We will continue to contact trace. As our numbers go up, we have put more staff in place. We are turning a floor of the department into a contact tracing floor so that all of our contact tracers internally will be in one place with their computers and able to share information so that we are not decentralized as far as contact tracing is concerned. But we will continue to contact trace. We ask you to be as upfront and to be as vigilant as you can and concrete as you can in giving us the information that we need in order to save lives. We are in month 9 or 10, depending on who you talk to, of this pandemic. We continue to talk about what you need to do, but I know that you know that. Do not believe anyone that tells you at the federal level or any other level that we are turning the corner. We are not turning the corner, and our numbers tell us we're not turning the corner. We need a national mask mandate. We need to be able to say to everyone, a face covering is life-saving, and we ask individuals to do that. Our local government has a role, but the national government has a role as well. The state government has a role. I will tell you that the Commonwealth of Massachusetts has done a wonderful job. I applaud the governor and the lieutenant governor for the work that they have done. But states can't do it alone, locals can't do it alone. We need the national government to be a part of the strategy, and for the most part, the messages have been extremely mixed. A national mask mandate, a national testing strategy, those are important things as we prepare, hopefully, to receive a vaccine within the next 6 months for everyone. That is actually our hope. I'm going to go back to our data just a little bit to end with the cases by age. We've talked about the cases by zip code, I believe, but let me talk about the cases by zip code. The areas that we are sending individuals to, we are going to be very targeted around are these. This week, the 01109 zip code was at 20, this week it's at 20%, last week 22. 01108 last week 21%, 19% this week. 01107, 9% this week, last week 6%. 01105, 5%, 8% last week, 5% this week. 01104, 17% this week, last week 18%. 01103 had no cases last week, it is 1%. 01151 was 2% last week, it's 8% this week. 01129, you are 6% this week, you were 3% last week. 01128, you are 2% this week, you were 5% last week. 01119, you are 5% this week, you were 10% last week. And 01118, you are 7% this week, and you are 3%, you were 3% last week. As you can see, the cases are going up across the city of Springfield. Bill, if you could give me the map that is the city of Springfield. And so, as you can see, the cases are going up across the city of Springfield. And so there is no neighborhood that's impacted. There is no race, there is no ethnicity, there is no individual, there is no age. No one is immune from this virus. And I just can't say that enough. The demographic data is inconclusive, but what it tells us from last week is that 34% of the cases that we identified were white, 17% were Black, African American, 23%, the race, ethnicity, that's the unknown category, race, ethnicity could not be determined. And then other is a data that we'll have to tease out better because I believe it contains more Hispanic individuals as well as more Black individuals. The challenge with the form that is used, it is not clear around how you tease out race and ethnicity. For example, in the form I looked at, Hispanic is not a category. And so that category has to be teased out by our ability to drill down. And we will do that for you for next week so we can have more conclusive numbers. But what this data is telling us is that there is no age group immune, and there certainly is no individual immune, and there's no geographic area in the city of Springfield, and I dare say across the Commonwealth. The travel orders stay the same, but it's important that you understand if you are coming from any place other than California, Hawaii, New Jersey, Washington State, Connecticut, DC, Maine, New Hampshire, New York, and Vermont, that you must self-quarantine for 14 days or you must have a negative test. Lastly, I want all of you to think about the fact that you have a personal stake in this. I want you to look at the eyes of your grandmother, your children, those individuals that you love and care about, and understand that anyone is at risk for this virus. Anyone is at risk for a negative outcome. While we are talking about long haulers disease, we really don't know what the impact of this virus is going to be long-term to our health status. And so it is important that you do the things that you are asked to do. Wear a face covering. Wash your hands. Physically distance. Stay home if you are sick. The African proverb, when spider webs unite, they can tie up a lion. If you think of yourself as a spider web, and you think about COVID-19 as a lion, if we all get together and do what we're asking you to do, then this second wave has got to be shorter than the first wave. However, small gatherings, large gatherings, it is small gatherings, it is households, it is individuals in this second wave that are fueling this. And young people, it's you. And you don't have the right to get me sick. That's not your right. I'm hopeful that you will understand your responsibility and do the things that we are asking you to do. And we will continue to be vigilant and make it through this virus. Thank you for your attention, and do the things we're asking you to do. And remember, we're going to be in your business, we're going to be in your neighborhood, and we're going to be in your face, because we are not going to have individuals die unnecessarily from a preventable virus. Thank you.
Thank you, Helen. Well put.
Very shy today, Helen, very good. I told you, listen to her message. We're now going to have an update pertaining to our schools. Superintendent Dan Warwick will come up at this point in time. Superintendent Warwick.
Thanks, Mayor. Good morning, everyone. As the Mayor said earlier, our meals program has been going outstanding. Since we closed down in March, we're up to 3,763,026 meals. Just this weekend alone, 101,224 meals. Working in cooperation with Helen and her department, we've set up a flu shot program at our schools, and working in conjunction with the health department CVS, and that will continue, and we'll have information on that on our website. Our remote learning, which we're still in, has been going very, very well. First month of school, we had 92% attendance, and again, the teachers, principals, and staffs at the school have done an outstanding job. As the Mayor alluded to earlier, we have a report from O'Reilly, Talbot, and Oaken coming, working in conjunction with Pat Sullivan, and again, Helen, to have an industrial hygienist analyze all of our buildings and give us recommendations on what we need to do to open safely. That report is due out soon, and we'll be reporting it to school committee. We're working now on distributing iPads. As you know, we've distributed laptops to everyone, but the schools are going to reach out to the parents of our students in preschool, and we're going to actually distribute iPads to everyone. And again, for families who can't pick them up at the school, we're going to work with our transportation company to deliver them. We are right now under a pause in our sports program, but working in conjunction with the health commissioner, we'll be making a recommendation to school committee on how we move forward with continuing the fall season or not. Again, we've had a helpline up on the technology piece, and that's been very, very helpful. So anyone who needs help, there is a helpline available. We'll get that help to you. As you know, we've been hit with a pretty significant ransomware attack, and we are in the recovery mode right now. We're in the process of rebuilding all of our systems. What we did was prioritize our software systems for our students, so we kept student learning going. We're in the process now of rebuilding all of our systems and investigating this, and we're working with the FBI and appropriate authorities on that. Thank you, Mayor.
Thanks, Superintendent Warwick, for the update. We'll now go into the public safety component of the city's update, and then we'll start with the Springfield Fire Commissioner B.J. Calvert.
Good morning, everybody. Thank you, Mayor. As the Mayor said, we have 2 people out this morning with COVID. They haven't tested positive, but they're in quarantine due to a close exposure. So we're monitoring that situation and awaiting their test results to come back. The other thing I wanted to discuss this morning, as the Mayor said, was a little reach out on the drag racing incident that had the other night on Plumtree Road. First, my condolences to the family members of those who lost their lives. Secondly, I'd like to discuss the dangers inherent with that dangerous activity. It places everybody at risk. Another vehicle was struck It was a first responder vehicle that was involved in the accident. Unfortunately, that person survived the accident. But in my 30 years as a professional paramedic and in the emergency services field, this is one of the most horrific accidents I've ever witnessed or been on the scene of. I was contacted right after the accident happened due to the fatalities and responded to the scene. And I have to say, this was truly a terrible accident. As I said, it was horrific, one of the worst I've ever encountered. So this should be a reminder to people that are out there drag racing to pay heed to this incident, because you can lose your life in the blink of an eye drag racing on city streets, and you need to be careful. Please pay attention to the accident that happened. Again, my condolences to the family, and thank you very much.
Thank you, Mr. Calvin. We'll now have the Police Commissioner, City of Springfield, Commissioner Cheryl Clapper.
Thank you, Mayor. Good morning, everyone. The weekend was busy for the police department. We had some more firearms incidents. They are under investigation. There was no life-threatening injuries. There was an arrest made. They had a great narcotics arrest and investigation Friday, and there'll be a press conference this afternoon at the station to discuss that. As the mayor mentioned, also last Wednesday I went to Boston. I was pleased to be there with Attorney Lelling from the U.S. Attorney's Office, Commissioner Gross from Boston, Chief Gomez from Brockton, Chief Kais from Chelsea. And the topic was gun violence, and we are all concerned. We are all facing an uptick in firearms charges and firearm violence. It's concerning to us, and what the most concerning thing about it is they're not being held at all. The offenders are being arrested, guns are being seized, people are being charged, and it's like a revolving door, and we know we're playing with fire. We know someone is going to get hurt. So if it takes working with U.S. Attorney's Office for more stringent penalties and sentences, so be it. We'll do what we have to do to keep women and men safe in the police department and to keep people in the community safe to do that. But Springfield is not the only community seeing that. It's across the state, and it is concerning. We will be ready to help with Commissioner Carlton and the Health Department and wherever we're needed if we're called upon once again to start enforcing the mask ordinance and requirements. We have seen young people without wearing the masks. We do carry extra masks with us. I will be sending out a notice to all the women and men in the police department to start enforcing if they will not comply. We would like to see compliance. If we don't see compliance, we do have options where we can start fining and warning, and if that's what it takes, so be it. Ellen, we'll do that. I concur with Commissioner Calvi. Unfortunately, the accident on Plumtree Road was horrific. It's a tragedy. The car involved, the speeds involved, whether or not the young people have a conception of the damage that can be done, of the injuries that can incur from traveling at that rate of speed, I'm not sure. There's reports of revving engines in the neighborhood just prior. Moments after the crash, one of my plainclothes detectives is coming through an intersection near the crash. He had a green light and was proceeding to travel through it when he saw headlights and stopped, thank God. Another vehicle went through a red light at about 100 miles an hour, we figure. So, but for the grace of God, another accident was avoided. So there is horrific body-worn camera footage of that accident. I debate in my mind, it's pretty gruesome to see, to witness. The officers on scene are requesting a debriefing. We will have that debriefing on Wednesday for officers that responded. It's horrific. A lot of them have children, kids that age that were involved, and it's a disturbing sight for sure. So we're having a debriefing. And this may be something that unfortunately people, and especially high school and early college kids, might have to see. It's not a video game. It was a horrific, tragic accident. And the police department sends its condolences certainly to the families involved. And we send our thoughts and prayers to AMR, who was also unfortunately involved, and she is lucky that she escaped that vehicle. How she did, I don't know, Patrick, I don't know. So thoughts and prayers around, and it's definitely something we will look at as a piece in education, especially when the schools get back into some sort of an order, maybe this spring, before the next summer break, to emphasize safety about traveling at that rate of speed. Thank you, Mayor.
Thank you, Commissioner Clapper. Well, now, Facilities and Park Management Director Pat Sullivan will come up and brief us.
Thank you, Mayor. We have 3 employees out with COVID. We take all precautions, and I want to thank the Mayor and Helen for ensuring we have all the safety supplies for our employees. Our building entrances at City Hall and Tapley Street will continue to be monitored through the winter. The 3 employees that have the COVID will be out for 14 days, and they had no direct contact with the public. The school plans for management of the HVAC systems will be ready to present to the school committee this Thursday. And as Helen indicated, that Sierra Arena will be closed on November 7th. And I want to again thank the mayor and Helen for taking the lead on that and just closing the arena immediately, knowing there was clusters across the Commonwealth and within the Western Mass area. So that was the right thing to do. They were about a week and a half ahead of the state. On non-COVID projects, the drawdown of the Lake Massasoit project will commence today. The mayor will be touring the site on Thursday, and I want to thank the mayor. This will be the second high-level dam for safety being addressed in the city. Van Horn Dam was done about 2 years ago, and this will protect the south end, and the north end is now well protected by the Van Horn Dam being completed. So congratulations, Mayor, on making sure we have the resources to do that project.
Thank you, Director Sullivan. Again, Springfield's in the business of doing business, and Chief Development Officer Tim Sheehan carries those easels because we're always pushing the city, promoting it, whether to expansion or come on down, open up in Springfield. Tim Sheehan.
Thank you, Mayor. Last Thursday, Governor Baker made an announcement of more than $770 million in state and federal assistance flowing from the state, and that is obviously very welcome news for Springfield and all the Massachusetts gateway cities. It includes $70 million in grants or technical assistance to small businesses with a focus on minority and women-owned businesses that have been disproportionately impacted by the pandemic. Additionally, there's $30 million allocated for job training. That funding is tied to programs that we have seen already have a proven successful track record in helping people get the skills that they need to get jobs that are currently available. Beyond the $50.8 million in small business grants, the $50.8 million in small business grants provide businesses with 50 or fewer employees with up to $75,000. Again, that's businesses with 50 or less employees can get a grant for $75,000. For those with 5 or fewer, they can get a grant for up to $25,000. This funding is intended to ease the transition for so many of the businesses that were able to operate somewhat successfully through the summer months to transition into the winter months dealing with the public health orders that are intended to keep us all safe going forward. Applications will be accepted by the Massachusetts Capital Growth Corporation for the grant funding over the next 3 weeks only. Again, the program is only going to be accepting applications for 3 weeks. Businesses are encouraged to apply early, that is, as in like today. Businesses in need of technical assistance to process the application should call the OPED office at 787-6020, where we can assist in directing you to one of the technical assistance organizations providing assistance and outreach. Additionally, the governor allocated $10 million to the Shared Streets Initiative and Space Program. That program has been used to facilitate activities like outdoor dining and getting the streets ready for that. It's been very successful. Additionally, $10 million for local recovery and planning grants. The city will certainly be exploring our applications to that program. And then an additional $10 million for museums, theaters, and other cultural facilities. And finally, up to $8.3 million in small business technical assistance to help businesses access both state, federal, local grant programs and loans. Finally, I think it's important to note that the governor rightly made the comparison on Thursday that the scale of assistance local and state governments can provide is simply not comparable to that of the federal government and the United States Treasury. While we remain hopeful that further economic relief is coming from Washington, the wait is certainly frustrating for many families, institutions, and businesses that are feeling the economic impact of this virus. Thank you, Mayor.
Thank you, Director Sheehan. Well put in. We, again, appreciate Governor Baker, Lieutenant Governor Polito, and their administration, the friendship that he continues to show to the city of Springfield and myself. That's deeply appreciated. We had the updates were given earlier for DPW on Director Signoli and Attorney HR Labor Director Bill Mahoney and Solicitor Ed Pakula. And so with that, we will open it up to questions and comments of my cabinet heads and myself, if there are any. Paul? She might be. She'll come in. Did you want to wait on that, or maybe it's something? Okay. Well, there she is. There she is.
The text alert is going to be from the Department of Public Health at the state, and is going to say that the city of Springfield has been designated as a red high-risk zone. We are asking all residents to take this virus seriously and do the mitigation efforts. It will talk about hand hygiene, staying home if you're sick. It'll talk about social distancing and face coverings. So that is going to go out to 22 cities and towns, including Holyoke, I believe, was on the list for Western Mass, and Springfield is on the list for Western Mass.
And you said that you're going to be targeting businesses, big box stores. What are you looking for? What are your inspectors looking for when they go to these places? If the problem is gatherings and houses, what's the issue?
The issue really is community spread. So the concern really is, even though we are not seeing the cases emanating from the big box or the businesses, what we know is that individuals are pre-symptomatic, potentially 2 days prior to being diagnosed, and are shedding the virus. And so they are visiting places outside of their household. In order to stop community spread, our job has to be to go to every place we can to see if compliance is being adhered to so that we can continue to mitigate this virus. Because we have the privilege of having addresses, names, as well as zip codes and ages, we are more able to drill down as far as individuals are concerned And we are getting good compliance when individuals are calling from the city of Springfield. When my contact tracers have a local number, it appears that we are getting a good deal of compliance. It is when a number comes from that they think might be a robocall, or it might be something that they don't need to pay attention to. That's where our residents are struggling, I think, to comply. So that's why, as much as we can, the city of Springfield tries to use our local contract tracers, which is why we are expanding our capacity to be able to do that as a municipality.
And in terms of the mention of testing going on, is there, because their testing is a little bit more available than it was before, what kind of guidance would you give out to people that, you know, are testing? I think somebody like myself, I'm not in regular contact with anybody that is unmasked or outside my household, but I do move around a lot. What kind of guidance would you give? Aren't necessarily symptomatic, aren't necessarily in contact, but maybe should or shouldn't consider testing?
I would recommend all individuals get tested. It is important to know your status. So if you know that you are COVID-free and had a negative test, then you can put those individuals in your environment at some kind of, make them feel more comfortable in your presence. When you're having small gatherings, I would recommend everyone who is going to be in that gathering be tested so you know their status when you go into that gathering. So the benefit of being tested, number one, it is free now. And so you can get it done at will, being asymptomatic. We know it's going to last through December 31st, definitely, but that I would recommend individuals be tested. And that if you're going to have a small gathering, if you're getting together for Thanksgiving, make sure those individuals that you're going to have dinner with are either wearing a face covering, which is hard to do and eat, but that they are going and having a negative test so that everyone in your environment feels comfortable.
Any other questions, Audrey, go ahead. Go ahead. Sure.
What was that?
Go ahead. Go.
I was just wondering, what particular areas of the city are you seeing as a problem? And are you finding it on cooler sites,
The areas we concentrated on were downtown and the north end and a little bit of the south end, lower south end. That's where the most complaints were coming from. That's where most of the citations and the criminal complaints came from. Our problem with the dirt bikes is they're starting to alter the exhausts to set off ShotSpotter, which is bad, in that we're going to ShotSpotter, which is good, and that we're finding where the dirt bikes are. So we did seem to track down 2 dirt bikes where they live, and we issued the citations. So it's a little bit of 2 evils there going on, but it's helping us locate. And if we find where you live, then we're getting the citations.
And usually we see this as a problem, leading into the summer when the weather gets warmer. Why the, I guess, industry for calls now?
My own guess, Audrey, and it's just my guess, is pandemic exhaustion. Time on their hands. People are out, creating their own entertainment in their own environment. And unfortunately, for one segment, this means how can we drive the police crazy? What can we do to our own cars and go to these car shows? And that's why I think you may still have the drag racing problem.
And I want to double check on the numbers again. How many citations, how many bikes confiscated from this past weekend?
Just the weekend, 11 citations and 2 criminal complaints.
But they have confiscated bikes prior.
Yes.
This phenomena, negative phenomena that's occurring is something that's occurring across the United States of America, especially in urban centers. Could be a little bit of COVID fatigue, but prior to that, as a kid, when it came wintertime or colder weather months, you never rode your bike in the snow and winter. You were seeing that going on prior. Now you're even seeing it with motorcycles. The illegal, dirt bikes are illegal. Shouldn't be on the roads. But what is very, very aggravating and disrespectful is that these individuals, and in essence, we're trying to save them from getting hurt too. But they want to be in your face. Whether you're walking, whether you're in a vehicle, a police officer, they don't care. They'll go right at the vehicle. And what happens then? Only negative things can happen at that point in time. So we're going to continue to be ever vigilant. The officers have to be very careful in any type of chases that occur, putting other people in harm's way. But this is just this attitude that has come about, and it doesn't matter what creed, color, background, small percentage of, I can do whatever I want, you can't do anything to me, and I think that's falling into the COVID-19 also, not following masking and other things there. And it's just, and it maybe when they get a little bit older, they might start to realize we were also thinking of them too, so they don't get hurt. But I think Helen and I were at a meeting Thursday night, Zoom meeting, neighborhood council, school committee meeting, Billy, I can't remember what it was. But they had a modified muffler exhaust, boom, 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 like shot spot, up and down downtown. Brave and dedicated men and women, they have to respond to that. Now, hopefully it helps us to find out where they are, but that's how disrespectful some of these individuals are. So, you know, we're going to stay vigilant on it. We'll try to arrest if possible. Hopefully our courts back it up. We'll try to confiscate as we have. We'll continue to give citation and criminal complaints, which if it attaches to them, if they do have a license or insurance or legal, many of these are illegal stolen bikes, now it's going to register at the registry too on it. But it's unacceptable. Unacceptable. And I know we can't get to everybody, but we're going to keep hammering away. Just a quality of life issue. And I think everybody across the board wants that, whether it's downtown or, which is a neighborhood area, or our neighborhood.
The citations have a fine attached to it. I believe it's $100.
You know, legal dumping is $300. We did the, Springfield candid camera, Smiley on candid camera, Springfield candid camera. Somebody could have got rid of that thing for $8. Now you've been embarrassed, which is exactly what we're going to continue to do. And now you're going to have to spend hundreds of dollars when you could have very easily gotten rid of it for $8. But again, you have that mentality of, I can do whatever I want. I don't have to follow the rules. I don't have to follow the laws. I can be disrespectful to anybody I want, young or old, because it's all about me. And I'm not saying you, but that's wrong. And people are fed up with it and sick of it, as I am. Any other questions or comments? Okay, thank you very much. I appreciate the media, and I appreciate the work of the cabinet heads, down the rank and file for the continued and dedicated efforts. Please heed the words of advice that came from the professionals, Dr. Kerouac, Dr. Rose, Commissioner Helen Carlton-Harris, when it comes to this COVID-19 coronavirus pandemic. We are entering a very pivotal time, a very dangerous time now. We did it before, being green, we can do it again. But you really need to follow the procedures. Please wear your masks. Wash your hands. If you don't feel good, stay home. Try to keep the social and physical distancing of 6 feet. And then be cognizant of these house parties and family gatherings that are coming together. And to the young people, you are not invincible. It's well over 76, 78% now. 50 under, 44%, 30 and under that are contracting this COVID-19 coronavirus. You don't want to put yourself where you're spreading it. You're going to be in the hospital, maybe, God forbid, be on a ventilator.
So it's the young people where this is being spread now. So please, heed the advice. So we will defeat this COVID-19. Good health and go out and have a great day. God bless. Thank you.